Before I proceed on scene, I'm going to make sure I have the right BSI and PPE on. Once I get on scene, I'm going to make sure it's safe. I'm going to make sure I know the MOI or NOI, and then the number of patients if I'm going to need additional resources, and I'm going to consider C-SPAN. After that, I'm going to check the levels of consciousness of the patient. I'm going to introduce myself to him. Hello, sir. I'm Grady Henderson with the HC ambulance. What seems to be the problem?
I have pain in my left chest and it hurts a lot.
Okay. He is alert because he is talking. Then I'm going to head into my ABCs, and his airway is patent because he is talking. And then I'm going to proceed into breathing. So I'm going to check his respiratory rate, watching out for rate, rhythm, and quality. After I do that, it would seem to be high. After that, I'm going to hook up oxygen at 15 milliliters at 100% oxygen. Then I'm going to proceed into circulation. Sir, can I check your pulse?
Yes.
And while I'm doing this, I'm checking the color, texture, and temperature of his skin. It seems to be cool and clammy, and his pulse seems to be fast. Once this happens, I'm going to prioritize the patient's transport, which I will transport, and he is going to be a high priority. Then I'm going to proceed into the history taking with the OPQRS. Sir, when did this happen?
It happened about 2 hours ago.
Okay, that was me checking the onset. Then P is checking for what makes it better or worse or provoke. Sir, is there anything that makes this worse or better?
Nothing makes it better, but when I move around it makes it a lot worse.
Okay, then I'm going to check for the quality. What kind of pain is this, sir?
It's like a shooting, stabbing pain in my chest.
Okay. Then I'm going to check for radiation. Does it go anywhere?
It moves down my left arm.
Okay. Then severity. On a scale of 1 to 10, how bad is this pain?
Probably about a 9.
Okay. Then time. How long ago did this start, sir?
Like an hour and a half.
Okay. Then I'm going to proceed into my other history, which is sample, signs and symptoms. Is there any other symptoms, sir?
I'm a little hard of breathing.
Okay. And I already covered that with the oxygen, so I don't have to worry about that right now. I'll check that later. Then I'm gonna check for allergies. Sir, are you allergic to anything?
No.
No? Then medications. Are you on any medications?
I'm on nitroglycerin and baby aspirin.
Okay. Then P, which is past pertinent history. Has anything like this happened in the recent history?
I had a heart attack a little over a year ago.
Okay. Then last oral intake. Sir, what's the last thing you ate?
I had eggs this morning for breakfast.
Okay. Then E will be events prior. What was happening before this happened?
I was mowing my lawn and I thought, my pain started coming on, so I went inside thinking it would make it feel better, and it didn't. It just got worse.
Okay. Then I'm going to proceed into my secondary assessment. First, I'm going to do a focused assessment on the affected area. I'm going to palpate the chest. Then after that, I'm going to check the vitals again, pulse, respiratory rate, and blood pressure. And then after that, I'm going to call medical control, give them a report, and then I'm going to ask if I can administer nitroglycerin and baby aspirin. And if they allow me to, I'm going to give him baby aspirin. But before, I'm going to check the 5 rights: right patient, right time, right medication, right route, and right dosage. So when I give him the nitroglycerin, I'm going to tell him to put it under his tongue and do not chew. Sir, can you take this nitroglycerin and put it under your tongue and not chew?
Yes.
After that, I'm going to administer baby aspirin using the same method. but I'm gonna tell him to chew since they are chewable. Sir, can you take these baby aspirin, chewing them?
Yep.
Here you go. After that, I'm gonna give a full detailed report to the hospital staff once I get there, a verbal report, and that should be it.